Hello everyone. Today, we're venturing into the sphere of a medication named Temazepam, popularly known by its brand name, Restoril. As is customary with our discussions, this information is purely for educational insights. If you harbor any health-related queries or concerns, it is always wise to consult a medical professional. Description: Temazepam, more commonly known by its brand name Restoril, is an oral capsule belonging to a group of drugs called benzodiazepines. It affects chemicals in the brain that may be unbalanced in people with sleep problems, insomnia. Restoril is principally prescribed to treat insomnia symptoms, such as trouble falling asleep or staying asleep. It is an intermediate-acting benzodiazepine, meaning its effects can last for several hours. While it's highly effective in inducing sleep, it's primarily meant for short-term use, typically 7 to 10 days or less. Warnings: Restoril should not be taken if you're allergic to temazepam or to other benzodiazepines. Misuse of this medication can lead to addiction, overdose, or even death, especially when combined with alcohol or other drugs that cause drowsiness or slow breathing. Taking this medication while pregnant can cause congenital disabilities or life-threatening withdrawal symptoms in the newborn. Additionally, Restoril might cause a severe allergic reaction or even complex sleep behaviors like sleep driving, sleepwalking, or making phone calls with no memory of the activity. Before taking this medicine. Before embarking on a course of Restoril, it's paramount to share any allergies with your healthcare provider. It's also essential to provide a complete medical history, especially if it involves liver or kidney disease, lung disease or breathing problems, depression or suicidal thoughts, or a history of drug or alcohol addiction. If you consume alcohol regularly, it's vital to disclose this to your healthcare provider. Avoid taking Restoril if you're pregnant or planning a pregnancy, as it can harm the unborn baby or lead to withdrawal symptoms in a newborn. Side effects: Like all medications, Restoril can have side effects. Some of the more common side effects include drowsiness, fatigue, dizziness, headache, or feeling nervous. More severe side effects may include confusion, agitation, aggression, hallucinations, memory problems, or feelings of depression and suicidal thoughts. Another significant concern is engaging in activities while not fully awake and later having no memory of them, like driving, cooking, eating, or making phone calls. If you experience any unusual or severe symptoms, it's crucial to consult your doctor immediately. Interactions: Restoril may interact with other medications, which can influence how it or the other drugs work or increase the risk of side effects. Always inform your healthcare provider about all the drugs you're taking, including prescription and over-the-counter medicines, vitamins, and herbal products. Dosage: Proper dosage is a cornerstone for the effectiveness of any medication. Always adhere to your doctor's recommendations when consuming Restoril. For insomnia, adults typically begin with a dose of 15 milligrams, taken at bedtime. Depending on individual needs and responses, this dosage may be adjusted by the healthcare provider. It's crucial not to exceed the recommended dose or use for extended periods without the supervision of a medical professional. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: While on Restoril, it's crucial to avoid drinking alcohol as it can intensify some of the side effects, including drowsiness. Since Restoril can impair your thinking or reactions, it's advised to avoid activities that require alertness, like driving or operating heavy machinery, until you know how this medication affects you. FAQ: A common query is about the duration for which Restoril can be safely used. Restoril is intended for short-term treatments, usually 7 to 10 days or less. Prolonged usage can lead to increased risks, including dependency. Always follow your healthcare provider's directions about the duration of treatment. Closing: That concludes our deep dive into Restoril. Please remember that this information serves an educational purpose and should not be seen as a substitute for expert medical counsel. Always reach out to a healthcare provider with any questions or concerns. Thank you for joining us.